Okay, there you go. Hello, hello. Okay. Good morning, everybody. Before we get started, if you are online, can you let us know if you can hear? We're just all going to wait for the chat to turn from 4 to 5. So, oh, there we go. We're good. Okay, perfect. Good morning, everybody. Thank you for joining us. Oh, it's very touchy. I apologize. Before we get started, just some housekeeping. We are offering some CEUs throughout the conference today, and we have switched up the way that we do that. Normally, you would sign a sheet in the back, but because we have our technology, if you could scan this QR code that we have on all of the tables, it'll take you to Survey Monkey survey, and you can fill out the survey, and you'll be able to select which CEUs you need. And if you're online, we will also drop that link in the chat. And then there's also a session evaluation tied to that. So if you don't need CEUs, we also encourage you to take that anyways, so we can get your feedback on the session. So I don't think I have any more comments. So without further ado, I'm going to turn over to our speakers from the Ohio State Nighthawk Center. So thank you. And also, if you have any questions, or comments or feedback that you'd like to give to the speakers throughout the presentation, and you're online, just go ahead and drop those in the chat. So thanks, everybody.
Thank you, Christine. All right. Thank you. Hello. Well, happy Friday. Good morning, everyone. My name is Margaret Rosenkrantz. I am a postdoctoral scholar at The Ohio State University Nighthawk Center. And I am here presenting with Miss Christine Brown. Christine, do you want to introduce yourself as well?
Testing.
Yeah, sounds good.
Okay. So my name is Christine Brown. I'm a clinical research assistant and also self-advocate faculty of LIND at the Ohio State University Nighthawk Center. Thanks for inviting us today to present on our research findings of the COVID-19 pandemic. We have stuff to share that'll be interesting.
Yes, we have all sorts of little research goodies to share with you. So we're going to go ahead and get started. Let's see if this guy works. Here we go. Oh, okay. There we go. All right. Can I start by asking how many of you work directly with people with intellectual disability? All right. And then maybe some supervisors. Okay, cool. Just curious. So I bet that what I'm going to share with you is something that you already know, which is that people with intellectual and developmental disabilities are at increased risk for a number of potentially poor outcomes, right? So we know that adults with IDD are at risk for poor mental health outcomes. So they're at an increased likelihood for psychiatric disorders. And that's relative to people who don't have IDD. So I believe the range of prevalence estimates for people who don't have IDD is somewhere between 8 to 18%. Relative to people with IDD, it's range between 30 to 50%. So it's significantly increased likelihood. We also know that folks with IDD are at increased risk for poor employment outcomes. So a tougher time finding jobs, tougher time keeping jobs, getting accommodations and things that they need to be successful in their jobs. And then also we know that they're at increased risk for social isolation. And I'm sure all of you can guess that there's also a link between social isolation and psychiatric disorders or mental health difficulties. If you're socially isolated, you don't have access to peers or friends or social circle, you're probably more likely to have some mental health problems, maybe some anxiety or some depression. Okay, jumping to a related topic. We know that service providers for people with IDD have had a lot of barriers and issues related to COVID-19. So issues related to transportation. Okay, so we have learned that there's a significant decrease, 80% in individuals served via transportation. Community participation supports, significant decrease there. Supported employment, small group employment. We know that there's been a big change in turnover rates as well for staff serving people with IDD. Okay. As far as direct service providers, we also know that they have had a tough time being able to do their job, right? And a lot of this is because there have been concerns about risk to themselves or risk to family members that might be vulnerable to impacts or effects of COVID-19, issues with wages. Lots of parents out there, right? I can relate to that, needing to educate their kids at home. So tough time kind of balancing that. Oops.
Oh.
There we go. All right. Keeping me on my toes. I like it. I like it. Increased risk for health problems, and then again, relating back to childcare. Now, this is not a study about direct service providers. This is a study about the impacts of COVID-19 on people with IDD. But this is important because people with IDD depend on direct service providers. And we have some really important results that are related to accessing services for folks with ID, very needed services. And so it's all related. It's kind of full circle, right? And Christine Brown is working on some really important stuff as well related to the direct service provider, the DSP crisis. So we're going to end our presentation kind of talking about that now. So bringing all this information together, it makes sense that there were concerns when the pandemic started that it was going to especially negatively impact people with IDD. And so we wanted to ask that question, hey, how is COVID-19 impacting this population? So to answer that, we decided to put together an online survey for individuals with intellectual and developmental disabilities.
Focused on adults.
Yes, this is just for adults. We actually did have a companion survey that we put together for families of children with IDD as well, but we're just going to be talking about adults for this presentation. I do have our contact information at the end of these slides if anybody is interested, by the way, in results related to families of kids with IDD, or if they have any follow-up questions about this survey and our results here, you're welcome to email either of us or ask questions at the end, your choice. So I'm going to talk a little bit about how we put this survey together and how we recruited people and kind of just how we set this research project up. And then I'm going to turn it over to Christine to share all of our results. So the way we started this, there are some researchers who very quickly put together this survey called the Epidemic Pandemic Impacts Inventory. This was a survey just meant for the general population, wanting to know about all of the ways that the pandemic was impacting people. Basically, we took that survey, we were going to make an adapted version of that survey, but we modified it so much that it kind of just became its own survey. So we can't even say it's an adapted version of that survey anymore. We did a lot of consultation with tons of DD agencies around Franklin County. So we consulted with the Department of Developmental Disabilities, the Developmental Disabilities Council, the Self-Determination Association. We checked in with the Mental Health Collaborative. And then we also ran our survey by researchers and self-advocates from the Ohio State University. So we did a lot of checking in with self-advocates, with providers, with researchers, with experts in this field to figure out what are the best questions to ask. So we wrote this survey, we made sure it was in clear language so that people with IDD could answer it themselves. And very globally, the questions that we wanted to know about were related to, the answers we wanted to know about were related to mental and physical health, employment, access to services, the degree to which people were connected with others or not, isolated. And then we also wanted to know about technology use because we are a technology first state, right, Christine?
Yes.
Okay. You know more about that than I do. So other survey adaptations, you want to just make sure that this was a really accessible survey for people with IDD. So we had a consent form also in clear language. Once the consent form was read, we had comprehension check questions just to make sure they understood what their rights were. We had the option to close the browser at any point so that folks could take breaks if they needed a break. Basically, they could come back to the survey at any point. There was an option to click a little button and have the survey read out loud. And then we had simplified response choices so that it wasn't, overly complicated, basically. Okay, to participate in the survey, we just wanted folks to be over the age of 18. We did not verify if people had an intellectual or developmental disability. We didn't ask for, a diagnostic evaluation report or anything like that. But we just asked people to report if they had an intellectual disability or a developmental disability or both. This is a longitudinal survey. So, fancy way to say that we sent the survey out at 2 different time points. So the first time point, and the timing matters, right? Because this pandemic, this whole experience, it's really just evolved. So the first time we sent the survey out was June of 2020. So that was just a couple months in, okay? We asked people to provide their email addresses if they wanted to be contacted again a second time. We reached back out to those folks who had given us our email addresses in December of 2020. Okay, so that was about 6 months later. And so then folks who were interested completed the survey a second time, December 2020, January 2021. We had a lot fewer participants that time. It was speculated that people had pandemic survey burnout. Basically, I think a lot of people were sending out surveys, trying to get a handle and understanding of what was going on. And I think people were just sick of filling out surveys by then. So the way that we recruited, we basically reached out to DD state agencies all over the United States. So we just got contact information. It's pretty easy to find on Google. And we emailed every state DD agency saying, hey, we've got this survey, click on this link. Please send this out to folks who are being served through your state agency. And we sent that reminder out a couple of times, and we kept the survey open for people to fill it out for about 3 weeks.
We worked with the National Association of State Directors of DD Services. I know the director there.
That's right. That's a good, yeah, I forgot about that. Thanks, Christine. Oops, hold on. Did I have anything more to say? I can't remember. Okay, just one more thing for the second time point. We just emailed participants who'd given us their email initially and said, hey, do you want to fill that again? If so, here you go. And we kept that survey open for longer because we had such a smaller sample size. We just wanted to make sure that if people wanted to, they had time to fill it out. So I'm going to pass it over to Christine. We're going to, basically I divided it up. So we have results from our first wave of data collection. And then we have results from our second wave. So I'll let Christine take over here.
So the first set of this, who were the survey participants, the most was the weight and the type of disability, difficulty doing errands alone, visiting doctor, shopping. Like we all know that because people did not have a way to get to go outside or go places, and as of now, there is no accessibility to get to use Uber or Lyft. I know that's going to change July 1st next year. But anyways, the second is difficulty with concentration, memory, or decision making. Then the others like difficulty dressing, bathing, difficulty walking or climbing, the blind and hard of hearing. Those were just some of the different types of disabilities. So here's the survey results. Most of them was Ohio, the state of Virginia, then other. So those were the state that we got. We tried to send it through AUCD, which Nice-Longer is part of, Association for University Centers of Disabilities. But it's, not everybody wanted to do it because they were surveyed out.
Yeah, Virginia really stepped up. I don't know who works at Virginia, but thanks to that person who really promoted this survey. Yeah, but mostly Ohio and Virginia.
Yeah. And who were the survey participants? More male than female, but these trans and I can't say that word.
Non-binary, yeah.
And then prefer not to answer. So more were male than female. And the age, as you see, the more people get older, the less they want to do the survey. It's every time as they get older, they don't want to.
Mm-hmm.
And that's just what we noticed.
Mm-hmm. Yeah, mostly people really concentrated in the 18 to 45 year range, younger folks.
And who were the surveys, what living arrangement? Most of them live with the parents. Then the second amount was living with living alone, the non-family member. Then this living at family members, and then group home. So we just saw this as an interesting way to see what kind of living situation. I can say that some people replied to where they lived in supported living, and then one time they moved back to the parents' house because of this staffing crisis. So the race and ethnicity, most of them were white. And then the second was Black or African American. Then you see these others that we have up here. So we got to see that. So here's the thing that was very big question. Who's getting county or state funded services before COVID-19? 80.7%, that's 368 said yes. Not receiving services, 17.7%, then not applicable. And who were, okay, then of those who were receiving services, how many are still getting county services? 84.5% no longer, 14.9%, then the not applicable. We think it's because some people, they honestly, when they were not going to their day program anymore, they were stuck in their house. They were thinking in their IQ, I'm I'm stuck in my house. I'm not doing anything. I'm not getting nothing.
Mhm.
So what we had to do, I don't know, Margaret, if it's on another slide, but I want to say it now. We had to redefine the question and say, if you have a service coordinator, a service and support administrator, case manager, please check yes. So we had to put that, because if we didn't say that, they were thinking, I'm not getting services.
Right.
Well, yeah, if they do have a SSA, they still get services in the county.
Right. Yeah.
The same.
Yeah. So yeah, that was such a good point that Christine brought up when we first saw these results. Like we first saw, oh my gosh, 15% of this is a really big group is saying, no, I don't get these services anymore. And that was really disturbing to see that. And then Christine said, is it that they have a pause in their services? They do still have them. They haven't lost them. We need to ask it differently. So is it that, yeah, to Christine's point, what if we say, do you have a service coordinator? Do you still have this touch point person, right? Are we going to see different results then? So we did have to, like she said, redefine it and ask it differently the second time around.
Yeah, so next slide.
Okay, there you go.
So of those who were receiving services, still getting waiver services during the pandemic, 264 said yes. No was 72. Again, that's maybe in their head because they're just not in their day program, or they're not having a job. So their brain was thinking, no, I'm not getting it. But that's just the thought. So here you go, this big thing about how people they said to us, how were they communicating, doing things, and using technology. The biggest one, video calls, like doing Zoom, or doing the other kind of technologies, or the phone calls, texting, social media, emails, then forms. And then it says here, like how often, 33% every day, 23% 1 to 2 days a week, and 20% 3 to 5 days a week, 23% several times a day. That's because when they weren't in the day program or had their job, they had nothing else to do but do this because they were bored. And here's the things we asked, what technology that participants wish they had since COVID-19, wish. And most of them were fine with the technology they had, but the biggest request was a laptop, then tablet, desktop, and then smartphone. And the employment, this is my big one. Out of it, the 181 reporting having a job before COVID, and of those were employed before COVID, 54% work less hours since COVID-19, 50% were laid off, and 42% reported they have not gotten unemployment. That was big one, because they did not get to qualify for that pandemic unemployment, which I was like, what? Sounds like disability discrimination. And 35% reported they did not find it easy to get unemployment. So the application process was just so hard. And of those who were employed, 29% reported still having to go into work and be close to others. Well, that could be people that were working like in the grocery store, or somewhere that's like where customers come in. And then 10% reporting to work more hours since COVID. Then health, 97% reported they have not had COVID-19. 85% reported that they have not been exposed to someone with it. Now, sometimes just saying this to you, they could say that, but they don't always know if they have been exposed. You know, just saying. And 12% reported that they are not sure if they have been exposed. Yeah.
And just a reminder too, this was somewhat early in the pandemic. So, you know, June of 2020, that's when folks were still, you know, maybe in lockdown, not going out as much. And so it's kind of interesting to see the second time around, the percentage that estimated they had been exposed.
And 60% reported knowing what to do if they were exposed to COVID-19. 77% report being able to get necessary medical treatment. 80% report being able to easily access protective gear. And most reported using protective gear all or most of the time. And so this one was interesting, talking about in-person providers using protective equipment. These were meaning both direct support professionals and was it also doctors? Yeah. So all the time was the highest, then not applicable 30%, but some people just say, well, it doesn't apply to me, so they put not applicable to them, just saying. And then most of the time, some of the time, and then never. 1% is very unlikely. Some people may say never because they got that confused with not applicable. Who knows? And the health, since the pandemic, 11% reported having more health problems. 50% reported more mental health problems. That's the big one. Oh,
hold on. Just a second.
yeah.
All right, sorry, I got excited there. All right, hold on.
Okay, so here's the biggest ones. The top ones of all the ones in red are the highest amounts of what people said. Worried, stressed, sad, nervous, and then all these others feelings. Those were the top 4. I think it's because, again, everybody was so worried or sad, like, I'm not in my day program, I'm not working anymore, is life, am I like, some people even thought, even if they're not legally in prison, they thought they were prisoned in their houses because they couldn't go anywhere.
Yeah, and if you combine some of these symptoms together, you can put them together to create diagnoses, right? So if you think about, you know, generalized anxiety disorder, feeling worried, feeling scared, feeling irritable, feeling jumpy, you know, put that together and that's, you know, that's anxiety. You know, depression, there's sadness, again, irritability, difficulty sleeping, feeling tired, feeling that impatience. So those were the big numbers that we were seeing, was kind of, you know, more of that anxiety and that depression, which makes sense when you're stuck at home and you've got a really big change in your routine and there's a lot of unknowns.
Were people allowed to select multiple?
Yes.
Yeah.
Yes. Good question. Yes. Check all that apply. Oops.
Did you go for it again?
Yeah. Hold up. There we go.
Okay, so here's how's your mental health treatment during the pandemic. Pretty much people said good. Then like fair, great, and poor. Sometimes people could just be putting what fair or great, because again, they were feeling those symptoms, so they just put maybe fair because or such, because that's all they could say.
Yeah, and this is all we asked, and I'm sorry, I forgot to put percentages here of what the percentage of people who are accessing mental health treatment. But because for most people, mental health treatment had transitioned to virtual, we wanted to know, how is that going? So, I mean, most people said good, that's nice. I think we asked some more detailed questions about mental health therapy in our second wave. Oh, and here we are,
There we go.
wave 2. Oh, hold on. Hold up.
the first.
There we go. Okay.
So yeah, this was a huge change. Just only 66 people replied in this one versus like 378 or whatever that number was.
Right.
And 50% were from Ohio, 35% was from Virginia, and then there were 7 other states. Like we've said, it's been more. Now this one, it was more 31 through 45-year-olds was more responses than 18 to 30, and 80% white, 11% black, half male and half female, couple of non-binary. Okay, so this is the second round, and usage of state or county services pre and post COVID-19, even though we know we're not out of this yet. 83% reported receiving service prior to COVID-19, and 87% have been able to receive these services since June of 2020. So there was a little bit of a jump, but some of that was maybe new waiver slots or something else. Okay.
Okay. There we go.
So the virtual in-person, 89%, that's 65, respondents still have a service coordinator. Again, we had to really make sure to say, if you have a service coordinator, SSA, or case manager, please check yes. 63.8% of participants reported services are online or virtual, like how the day programs and stuff were doing virtual. And 46.8% of people reported in-person services.
So based on these numbers, it was very likely that some folks had hybrid access, right? Some people were online and some people were in person as well.
And satisfaction with state or county services, most people were satisfied, some unsatisfied. Okay. State waivers pre and post. Pre-COVID, the access to waivers was 73.8%, and then like at post, it's gone to 75.4%, and like the no access went from 21.5% to 18.5%, and so So, and then there's some other that said 8.2 or 6.2, whatever.
Not applicable.
Can't read that
So
one.
tiny increase. If we just asked folks to say, hey, did you report back before the pandemic, did you have access to a waiver? And then we want to know, all right, since the pandemic started, now have you had access to a waiver? So very tiny increase.
Then this was the big technology and its use. They were 81% was using technology to communicate with others. And it's because when people were just not used to doing FaceTime, Messenger, like an everyday thing, because they were originally getting to use be in their day program or such. Now that changed, and then 68% of people use technology to talk to people every day or several times a day, and 32% reporting using technology to talk to people several times per week. So that's the list of what they were doing: talking to friends, talking to family, appointments with some people.
Yeah, like service providers, doctors, things like that. Okay.
So the employment, 29 of the sample reported having a job prior to COVID-19. Of the group participants who still work, 27% reported working fewer hours, 17% reported working more hours, and 37% reported working in close contact with others. And that's about 1/3 of the participants who had a job prior to COVID reported they have been laid off from their job since June of 2020. And of the 9 respondents, 2 were able to get unemployment and 5 were unable to get unemployment or find a new job.
Yeah, so to put that another way, we asked, okay, since we last surveyed you, have any of you lost your job? And so 9 more folks had. So 1/3 of this little sample of people who reported having a job before the pandemic said, yep, we've lost our job. And, it's kind of somewhat similar numbers. I mean, it was about 50% from our first wave of data, and then about 1/3 from the second wave. So still a pretty sizable number. And folks were still reporting that they're having a tough time getting unemployment.
So like the big things we asked, like, were you able to pay your bills and like rent and afford food? And most said yes, and a certain percent said no. Access to medical care and prescription. Most of people said yes, and there was a small amount that said no, and then not applicable. Access to medical care, and then the access to prescriptions. Pretty much everybody had access to prescriptions. I think why they say medical care is because they weren't able to go to their doctor. So that's why they put no, is my thought.
Yeah, it makes sense, right? So during the pandemic, it's a lot harder to get access to appointments, but keeping your prescriptions up is fine, right? Just being able to pop into CVS or Walgreens and grab your prescriptions versus going to an appointment. Maybe video appointments were not possible, or setting up those appointments was difficult. So it makes sense to me that more people are saying that they're having a tough time with accessing medical care versus people saying, yeah, I was able to get my prescriptions.
And then here's where we collected increased mental health symptoms since summer of 20. And the big thing is 50.8%, and was what it was. And access to no was 46%, and a small amount of not applicable. And then accessing care for mental health symptoms. We had 54% saying they had access, 38.1% said they didn't. Sometimes that's again because they didn't have internet access, so they couldn't do telehealth and couldn't go to their doctor. So that's one reason they were putting that answer. Then 7.9% just, oh, sorry, these are so much differences in my eyesight.
It's a lot of colors. Yeah.
Sorry.
So no, this is good. So yeah, pretty much exactly like last time. Okay. So both waves of data collection, both in June and in December of 2020, you know, about 50% were saying, yep, I am having more mental health problems since the pandemic started. And then about half of the folks who were reporting more mental health problems were saying, and yeah, I am accessing care to help with my mental health symptoms.
So this is the second round, and what their biggest thing, again, worried, stressed, nervous, annoyed easily, sad, problems, that's sleeping. So same kind of mental health symptoms as the first wave. And therapy, they most had good, then fair, so, and then freedom. So it's like the same results, really.
Yeah, super similar.
Super alike. And then frequent mental health problems since COVID-19. Sometimes was the highest, not applicable 30%. Now, sometimes I could say some people just say not applicable because they don't want to say what they really have. So sometimes they could do that and put that answer. And then the rarely and often, most of the time.
If you think about it, if you put it together, so often and most of the time, close to about 20%. So about 20% of the sample, you know, is really impacting their daily lives, their mental health difficulties. Then about a third of the sample reporting, yeah, sometimes I have it.
And have you spent more time on screens and devices? Like all of us have. It's been like the screen has almost become our new everyday life. And so 79.4% said yes, and 19% said no, and then not like probably one person.
Yeah, I have to say it's embarrassing to look at my iPhone. Tells me every Sunday how much time I've spent on my screen. And if you look at it from before the pandemic, I'm just like, oh my God, it's just not great. But yeah, I mean, I think I bet everyone in this room has had this as well, right? Just more time indoors, more time on your screens. More time on your screens means, you know, increased risk for health problems and potential mental health problems as well. So it's this is why we wanted to ask this question.
So of this COVID-19, 63 people reported being scared to see a doctor or go to the hospital when sick, because they were worried that if they went in there, they would get it. And then 88.9% of people have not gotten the COVID-19. Now, of course, we all know this was before we've seen such the spike all over the universe here. So they just put the answer that they were, okay? That could be way different now versus then. And 30.2% have been exposed to the virus, and 76.2% felt they knew how to handle an exposure, and 92.1% reported that service providers always use protective gear during in-person appointments. And of these 38 individuals with a support person, 21 reported that their support person uses protective gear.
Okay, so that's, of that group of people who had a support person, just about half were reporting that their support person was using protective gear. Now, we didn't ask, who is your support person? Is it a family member? Is it someone coming from the agency? So obviously that makes a difference. But still worth noting that, yeah.
Whether or not the individual was filling out the survey themselves, or
Yeah.
Yeah.
Good question. I thought we had that on here too, but yeah, we asked folks when they're filling out the survey, are you filling this out on your own? Are you filling it out with a caregiver, with a service provider, or with a friend?
Or they also had a provider speaking on behalf of the individual too.
Right.
That was another to click.
Mm-hmm. Yep. So, yeah, I thought we did report that here, but maybe we don't. But most people said that they filled this survey out with the help of someone else.
Yeah.
Yeah, great question.
I asked that because we're not knowing whether that's the service provider or the waiver services anymore. Right. Someone who's not that may not know that, or maybe the individual doesn't realize themselves because they're not the ones getting the email.
Exactly.
SSA, not to knock county boards at all, but SSA sometimes we're hard to get hold of.
Yes. Yes, absolutely. Absolutely. Exactly. Absolutely. Yeah. Yeah. That was a limitation, of the study, because it was an online survey, and we'll get to that. But basically that, if it was the adult with ID or IDD who was filling it out, maybe they weren't certain because they weren't the ones that were in contact, or perhaps the person that was helping them fill it out was like, I don't know, I'm just your friend, I'm your neighbor, So yeah, that was a drawback for sure.
So like in the adult day programs and volunteering, like prior to COVID-19, they had 36.5% had the adult day program, and 82.6%, that's 23, for their day program stopped due to the pandemic. 38.1% volunteered before COVID-19, and 70.8% had to stop due to the pandemic.
Yeah. Okay, so yeah, that's kind of an important one. Most people who had adult daycare programs before COVID-19 said that they had stopped during the pandemic. We did not ask follow-up questions as to what was happening now. Maybe they were accessing some online kind of services, but certainly you can't have online adult daycare program services from like 8 to 4, right? So, and this was months into the pandemic, so notable finding.
So how many times did you leave the house in the last week? We just did this to see if they were being stuck in their house, or did they try to go out? So the most said 6 or more times, then 2 to 3 times, and then about the once or 4 to 5 times was a tie. And 70.9% always left the house with another person. So with the caregiver or the parent or somebody. And 94.5% were social distancing, and 98.2% wore a mask, 81.1% used hand sanitizer, 90.9% used these measures all the time.
So I find that interesting, that 29% say that they go out 6 or more times, so basically almost every day.
Mhm.
But yet they were having increased symptoms of anxiety and all those kinds of things. It's like it almost doesn't
Mhm.
correlate
Mhm.
with
Mhm.
the other things.
Mhm.
You're not going to your programs and things.
Mhm.
You're having all this fear and anxiety,
Right.
but you're still going out every day.
Right.
It just
Yeah.
makes me wonder.
It is. Well, if you think about it, not everybody was reporting those mental health symptoms. It wasn't 100% of the sample. And so then if you also, the way I think about it too, is there are folks, with developmental disabilities, like maybe autism, who didn't rely on DD services, had a full-time job, were maybe experiencing anxiety, but still had to go out and do their job. Right. So there's, it's definitely, there's quite, there's some variability in these samples. So yeah, it is interesting. Whoops.
Oh,
Whoops. You want me to take over here and kind
Yeah.
of summarize here? Okay, so here we go. Conclusions. I want to just wrap up with some of our key findings here, just to kind of bring it all together. So half of the sample, and we had a big sample the first time around, was reporting more mental health problems. So we were seeing more worry, stress, sadness. Those are the top 3 issues. So 15% was reporting that they no longer could access their state or county DD services. Half of the sample who had a job before COVID-19, they were laid off during that period of between March and June of 2020. And about a third of that group said, hey, I had a tough time getting unemployment. I still have not gotten it. And about 60% said, I know what to do if I have COVID-19 symptoms. So that was wave 1. There you go, wave 2. All right, same thing. About half the sample said, yeah, I have now increased symptoms since the last time I filled out the survey. Similar percentages: worry, stress, and anxiety. So I thought it was interesting that the first time point, sadness, was in the top 3. Change in routine, not seeing friends, having that kind of social isolation. This time around, it had been, more than 6 months. And so sadness kind of dropped out, and anxiety stepped up. And so that makes sense to me, because at that point, it's like, it's been months. I don't know what's going to happen next. The things that used to be part of the daily fabric of my life are no longer here. So big changes. And that makes sense to me, that anxiety kind of remained at the forefront and sadness kind of dropped out. Increase at this time around, more people, so 76% said, yes, I know what to do if I have COVID-19 symptoms. And that's pretty neat, because that tells me that folks were really taking care to educate about how to take care of yourself if you were exposed or if you had symptoms. 10% said they had trouble accessing medical care. I think that's a finding that's worth noting. And again, about a third of the sample said, I have been laid off since the last time I took this survey. So more people laid off. Okay, so kind of bring it all together, what we were finding was access to services remaining a problem, mental health difficulties also a problem, and then employment a problem. Okay. All right, we had some limitations in this survey. Surprise, surprise, like any research study. So first thing is that this is an online survey. So that means that folks who do not have access to internet, who do not have money to access internet, who have not great internet, maybe in more rural areas, they were not able to access online surveys. So that's an issue, right? We recruited from DD agencies. Of course, that limits our participants to folks who access those services. We know that there are tons of people with IDD who do not, who are not known to state or county DD services. So that's certainly worth noting. We did not verify disability status, so we just let people self-report and just chose to believe them. As we noted, the second wave of data collection was much smaller than the first wave. And then, we noted this, but it's possible that some of the questions were not understood in the way that we wanted them to be. So again, like some of those questions about accessing services. So what are the implications of these findings? I am biased because my background is psychology. So I'm always going to be thinking about mental health, but I think that's a largely, that can be a very much an overlooked problem in this population. I think, people with IDD, if they're experiencing mental health problems, people might say, no, you've got a behavior problem, or they may not recognize symptoms of trauma, or they may say, no, they may mistake some of these symptoms of mental health for, that's just your intellectual disability diagnosis. That's not a mental health problem. I've spoken with a lot of people who didn't even know that mental health could be a thing in people with IDD, and that just drives me bonkers. But the numbers indicate that access to mental health services is very much a need, particularly during this time where folks are at increased risk for social isolation. There are big changes in routine. There are a lot of unknowns. And then, as we identified, a lot of people are having more mental health difficulties. So obviously, there's a need for continued professional development for clinicians to understand how they can effectively treat people with IDD. Another need that came out of our findings was that people need more support in accessing employment and then accessing unemployment, right? So a lot of people were reporting that they lost their job, that they worked fewer hours, that perhaps they were going in and working more hours and being really close to people. And so there's a lot around there that spoke to us that said, hey, advocacy as far as accessing employment and unemployment is really a need. Do you have a question, Christine?
Yeah, I do. Did you guys ask what type of employment people had? Because I know the access to unemployment doesn't surprise me because there is a law, there's regulation out there that people who work under, like, I forget the technical term that's in the rule, where work under a certain kind of vocab training that you don't access, you cannot access unemployment because these kinds of, the way that it's structured, providers who may be providing that specific employment don't pay into unemployment.
Right.
So I was just wondering if you could tell from any of the data in there, how that's spliced out.
Sure.
I'd be interested to see if you're able to break that down. Would that unemployment service number have gone down because of that, like, weird legal restriction?
Yeah, that's a really good question. I think we actually did ask what types of employment folks had in our second survey. We didn't report on it here, but I wrote that down here and I can email you after. Did I see a hand raise?
Yeah, there's also a threshold for number of hours you have to work to be eligible for unemployment.
Sure.
And as far as access to unemployment, that was widespread in Ohio because the system was totally overwhelmed with the level of unemployment. So pretty much everybody had trouble.
Absolutely. That is such a good point, that this was not unique to folks with IDD.
Just really their whole computer system couldn't handle that application. That's why they're having to try to redesign the thing.
Mm-hmm.
That's why I'd be really interested to know how that's spliced out with the accessing, if it was really something that people just weren't legally able to.
Right.
Or if it was, to Phil's point, was it something that it was just
Right.
the inaccessibility was more tied to
Sure.
people, the system was terrible.
Sure. And the way that we said, did you try to access unemployment? First question. That was like the screener. Yes. Okay. Did you have a tough time getting it? And were you able to get it? That said, we don't know who knew or didn't know about those legal restrictions too. So
I know it may also be hard. People don't, just the way people flow in and out of different employment types.
Right.
It was confusing about, you may not even know that you work at a place that has the restrictions.
yep, exactly.
Mhm.
Exactly. Yeah. Right. Okay. Issues with accessing DD services. Okay. So now we kind of mentioned this at the beginning, but staff turnover, direct service providers were, they were also experiencing a lot of barriers to being able to engage in this kind of employment. And this has become quite an issue. Staff turnover has always been an issue in the IDD field, and then the pandemic kind of exacerbated that. So Christine is going to share a little bit about some work that she's doing related to
Thanks.
that. Yeah.
So the thing is that we now at the Neislinger Center, with the help from us, also working with Scott Marks and Nick Miller at the Department of DD, we have been doing what you call a DSP workforce crisis study and the competency-based add-on. Who in this room knows of the competency-based add-on? Raise your hand. Okay. Well, it's a very low amount. Yeah. Well, the thing is that under studies, the competency-based add-on, when it was designed under Director John Martin, it only applies to the IA waiver, not level 1 or self. And I'm telling you what I keep telling Jeff Davis and everyone at the department, and I told this to Scott. You guys are the staff. And instead of the word money follows the person, should be salary follows the person. Wherever you're working, go to a IO person, level 1, self. You should take that salary with you. And that's what I keep saying, because it's just silly that I'm not saying anyone says this in here, but fake that someone would say it out somewhere. Somebody out there could say, well, I'm going to go to anyone that's on IO because I can get this competency base. I won't serve a level 1 or self. That's a joke, okay? Not saying that's true. But under research already, we have created, and before you guys go, we have handouts for you to take. We have this thing about the direct support professionals, DSP crisis. We are gonna have a disability news brief come out soon about what it's like in the DSP workforce crisis. I can't believe to say to you this, but I got something from a affiliation, someone that's affiliated with our USEDS, the USED of Michigan, and believe it or not, the salary looks higher in Michigan than Ohio. I hate to say, I'm saying what I find in research.
So I know we're out of time here.
Sorry.
So we have Christine has all of these handouts related to DSP stuff if anyone is interested. And then this is our contact information. We'll stick around if anyone else has any questions, but
And we got this disability and health partnership. That's a project that we got a 5-year grant from the CDC. And then some basic stuff of Nice Songer and some business cards I brought. So I hope you all like this info, and please be advised that when we have the survey from our Lend trainees, there's already about 12 agencies from OPRA, I heard, who are wanting to take that competency-based questionnaire survey. But there's a lot of providers, and like even in Lucas County, there's more than 300 providers, but only 19 agencies and 10 independents get the competency-based add-on. I heard that. That's a shock.
yeah.
So we'll have info to send out.
Yep. Thank you so much, everyone.
And I'll be around here till noon to give out info if anyone wants to talk more or ask me on stuff.